Okay, so we're going to go ahead and talk about oxycodone today. So, in the early 2000s, there was a drug for pain, and it was called oxycontin, which is a long-acting form of oxycodone, meaning you would take a pill and it would stay in your body for about 12 hours, and you would take two pills of these a day, one pill every 12 hours, and various doses. People quickly discovered that those pills could be crushed and then it would become immediate release oxycodone, and then people would either swallow it or snort it or inject it or something like that. And you can watch and learn about that on the documentary called The Oxycontin Express. So OxyContin became almost synonymous with drug abuse in this country. And a lot of doctors wanted to steer away from prescribing OxyContin because they did not want to get involved in any type of uh, issues with the DEA. They just didn't want to have to deal with OxyContin at all. So a lot of doctors stopped prescribing it. Then in 2010, Purdue Pharmaceuticals created an abuse deterrent OxyContin, which they state is not really crushable. So what this means is that the abuse risk is gone. So someone couldn't just get OxyContin, crush it, and then take all the oxycodone from it. So that seemed to work for a little bit, and what ultimately happened is that a lot of people that were abusing OxyContin then started asking for immediate release oxycodone and would start saying to their physicians that only oxycodone 30 milligrams works for their pain. And quickly, oxycodone immediate release 30 milligrams became synonymous with drug abuse. And again, we went through the issue or are going through the issues of doctors not wanting to prescribe oxycodone 30 milligrams because it is associated with street sales and it's associated with drug use and so forth and so on. The problem is that there may be and there are some patients who benefit from oxycodone 30, and unfortunately, because of the stigma surrounding it, it becomes difficult to prescribe that drug. Simply because a physician who prescribes that drug is going to be under more intense scrutiny, um, and no one wants to be under the microscope quite in that way. So a lot of doctors are refusing to write for oxycodone 30 and only stick to 20s or 15s or 10s or 5s. Um, how do we solve this dilemma, this problem? I don't know. I mean, many do that many people need oxycodone 30 who are on oxycodone 30 milligrams now? Probably not. Um, but if a patient demonstrates that they have good results with oxycodone by improved function or being able to go to work or any of those other things, who am I really to say that they shouldn't be getting it? So it's definitely a quandary, hasn't been solved. Um, what sucks for the physician is the intense scrutiny that is done whenever that drug is prescribed, and that's why a lot of us simply just want to steer clear away from it. I mean, we know that a lot of opioids work for pain, so it should be not too difficult to switch from one opioid to another opioid and still get relatively good effects. Um, so hopefully that will work. But time will tell how this issue gets resolved. And that's it, everyone. Take care.